Oh, hello. Now I know what you must be thinking. Why am I doing this? Why am I smoking? Why am I addicted to something that is so detrimental to my health? But unfortunately, the reality is a lot of us still are. Now, in today's episode, in Health Matters, what we'll be looking at is not cigarettes, but what cigarettes can do to you. Yes, I'm talking about lung cancer. Now, lung cancer is one of the most prevalent cancers in Malaysian men, and maybe it's time for them to take a look at their habits and maybe put down the cigarette. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Hi, welcome. This is Health Matters with me, Dishen Kumar. And earlier, I was actually talking about today's topic, which is lung cancer. And it's something that I think all of us know about, and it's also a very big issue in Malaysia, especially for men. So joining me today is Dr. Toh Laiman, who is the consultant clinical oncologist and also the Vice President of the Lung Cancer Network Malaysia. Thank you, Doctor, for joining us today.
Thank you, Dishen. Thank you for having me.
Okay, let's start off with a very generic question, which is on everybody's mind. What actually classifies as a lung cancer?
So, lung cancer denotes any cancer where the cell of origin or the place where it first starts is in the lung or the airway itself. Sometimes when you have cancers in other parts of the body, they may metastasize to the lung. For example, from the colon, it travels in the bloodstream and deposits in the lung. That is not classified as lung cancer.
Okay.
So lung cancer is purely cancers which arise in the lung.
Okay. Now, talking about, is there any difference? Because is it treated very differently if it actually metastasizes somewhere else and comes to your lungs, or compared to when it actually metastasizes in the lungs as well?
Yes, so that's an excellent point, and it matters greatly because the treatment that we direct towards the tumor cells depend on where it originates. So the chemotherapy drug or targeted therapy drug that we use for colon cancer will still be for colon cancer even if it's in the lung.
Okay.
But conversely, if it starts in the lung, we need to have a different set of drugs for that particular tumor.
Okay, all right. So there are different types of lung cancer. Can we talk about that, the different types of lung cancer?
The different types of lung cancer are, broadly speaking, non-small cell lung cancer and small cell lung cancer.
Okay.
Non-small cell being about 85 to 90%, small cell 10 to 15%. Again, it boils down to what these tumors look like under a microscope.
Okay.
So that's how we denote which sort of cancer they are.
Okay. And talking about how rare is non-small cell compared to small cell cancer in Malaysia?
The incidence of non-small cell versus small cell in Malaysia is quite reflective of what's happening in the rest of the world. Non-small cell is probably more common because the cells that produce lung cancer in the lung are more predominant compared to the cells from which small cell lung cancer arises from.
So let's move on, Doctor, into who can actually get cancer. Are all of us exposed to lung cancer? Can anybody get it?
So lung cancer, the most common cause of lung cancer is probably due to smoking, so environmental exposure to a carcinogen that's found in cigarette smoking. But increasingly, probably about 30 to 40 of my patients that come through my clinic with lung cancer were never smokers or even light smokers. So that's quite interesting, and that seems to be reflected in global statistics as well. In terms of inheritance, so for most famously the Angelina Jolie story, which is she inherited a gene called BRCA. For lung cancer, there doesn't seem to be that genetic link with an inherited disposition. But of course, our research may not have caught up with all the spectrum of genetic associations there may be.
Okay. And can non-smokers, like you were saying about non-smokers getting lung cancer, do we know why?
We don't really know why exactly, but there has been some interesting research that has been published which may point towards certain factors.
Okay.
For example, there was a big study in Singapore and then subsequently in the States, which looked at the risk of cancer among women who walked fried.
Oh,
Yes.
wow. Okay.
So not only the chemicals that are produced through the wok frying, but also the resultant meat in which was wok fried and they consumed. And they found that these chemicals in that were found in the bodies of these patients could potentially lead to lung cancer. So that could be one association. I mean, certainly we are exposed to environmental toxins that we may not be able to account for. People who anecdotally, groups of people who live next to factories, live next to certain plants have developed lung cancer, but it's quite difficult, as you can probably appreciate, to really pinpoint the exact environmental response, the chemical that was responsible.
Okay, talking about that, because you've always heard these stories, especially when you want to ask someone to quit smoking, because smoking actually causes one of the main causes of lung cancer. They always say, like, I had an uncle who smoked for 60 years but nothing happened to him. And then we hear about people who've been doing it for 5 years and suddenly they get lung cancer. So is there a genetic influence in that?
Funny, a lot of my patients have that same uncle.
Right.
Whenever I tell them to stop smoking. So again, it probably boils down to the patient's susceptibility to a particular environmental toxin. That person who, I'm sure there are many people who have been exposed to cigarette smoking but yet don't develop lung cancer.
Yeah.
Those people probably genetically, inherently are more resistant to developing DNA damage, whereas some people are more susceptible. But the thing is, we can't pick out who's who.
Yeah.
So as from a medical viewpoint, of course, the less you smoke or even quitting smoking altogether is the best prevention strategy.
So even quitting smoking actually make you reduces your risk greatly in where the actual body can actually stop polluting your body, as you say.
That's absolutely right. So when you, even though you smoke for 10, 20 years, the moment you stop smoking and stop smoking totally, your risk reduces. So that may be something in that our body is able to repair or even prevent the occurrence of cancer.
Do a lot of your patients, after being diagnosed, is there a lot of regret in that?
There is some sort of regret, but yet the emotional response to a diagnosis can be quite varied. There is regret, there is anger, there is denial, disbelief. I think it's not easy to get hit with a diagnosis of lung cancer.
Okay, all right. Thank you so much, doctor. We'll actually be right back after this, talking more about lung cancer. Maybe we'll go into treatments and also clinical trials. This is Health Matters with me, Dishen Kumar. We'll be back after this.